Welcome, everybody. My name is Sophia Greskin, and on behalf of the USC Institute on Inequalities and Global Health, it's my great pleasure to welcome you to today's dialogue, Reimagining Global Health Research Partnerships in a Time of Crisis. So if this is your first time joining an Institute event, a special welcome to you. For those who have attended our events previously, a special welcome to you as well. This event is the first of our academic year, and it kicks off our series, which is focused on the implications of the current moment for global and multi-country partnerships. And our hope is that today's dialogue is going to help set the scene for what's to come. There's going to be many opportunities for collective discussion of these issues over the coming months that we plan to facilitate. So stay tuned for more ways to engage. And I wanted to start by saying something about why are we doing this? And I don't think it's a stretch to say that for all of us, wherever it is that we're based, the current moment continues to be filled with challenges, institutional challenges, political ones, ideological ones, financial ones. Just to be real, it's an incredibly hard time to do good global health work, wherever it is that we do work, and let alone to do global health work that addresses human rights or addresses inequalities and how it gets done, let alone maintaining partnerships in equitable terms. And that's, again, not even saying anything about trying to foster new ones. So for today's event, we're really taking these challenges of the current moment as a starting point. I think we're all really concerned about what roles we can play to ensure that this moment doesn't result in reinforcing or deepening existing power asymmetries. And in many ways, I think that's what motivates this series. I don't in any way want to pretend that things were perfect before. We all know myriad examples of partnerships that were unequal, that were extractive, that tokenized, but some of the basics of what allowed for successful partnerships that did occur, that's also now what's being challenged. So the playing field is worse, it's not better. And simply the ability to co-create research and ways of working together, let alone to embed partnerships in communities, are challenged by a whole range of new externalities. So that's not just frankly threatening our research and our partnerships, but also what it means to address the health needs of the communities we work with. And that's, frankly, the most important and the most challenging at this point. So I think the key question we really want to discuss is how best to minimize the harms that are caused by these shifting dynamics in global health. And is there a way that we can use this moment to accelerate research partnerships along more equal lines? We can't go backwards as a field, thinking positively what's needed, what's possible to move us forward. So in terms of today's event, I'm joined by an incredible group of global health leaders, long-term colleagues and friends, if I may say, true visionaries. They all join us with an immense amount to share about global health partnerships and hopefully some thoughts on how to help move us forward. I'm going to briefly introduce each of you, but I also want to say I'm not going to do anyone justice. Please, everybody share, look at the Humanitics so you can see how incredible these folks are. I'm just going to be very brief just to kind of not take too much time. So I will start with Alan Maleche, who is a health law and human rights expert and the executive director of Kellen. And for those who don't know, Kellen is a Kenya-based NGO that works to ensure the full enjoyment of health-related human rights for all people. Natalia Linu is a social epidemiologist and the deputy director of UNDP's HIV and health team. Natalia has worked in global development and health equity for almost 2 decades and oversees the work of UNDP on addressing non-communicable diseases, environmental determinants of health, including climate change, and health in crisis and conflict. Keith Martin is a physician and former member of Parliament in Canada's House of Commons, and since September 2012 has served as the founding executive director of the Consortium of Universities for Global Health, a Washington, D.C.-based organization of now over 190 academic institutions and other organizations. And Sabina Rashid is a medical anthropologist and the Chowdhury Chair in Health and Poverty, the director and founder of the Center for Gender and Sexual and Reproductive Health and Rights, co-founder of the Center of Excellence for Urban Equity and Health, and former dean of the Brack James P. Grant School of Public Health at Brack University. And with that, I'm going to say that I'm going to run this as a dialogue. Please put your questions into the Q&A function. And here we go. Let me begin with my first question. So for all of you, you represent really different kinds of institutions. And I think together there's really a collective wisdom of people who are engaged in very different kinds of ways and what it means to have a global health research partnership. So to start us off, I have kind of a two-part question. So, first, if you could say something about the sorts of international collaborations you and your organizations have been engaged in over the years, like what's defined as successful partnership in that context? And then to get to the part two of this is with all of the changes to the global health architecture over the past months, with everyone scrambling and trying to make new sense of the world we're living in, uh, what aspects of collaboration are of specific concern to you and to the communities that you work with in the current moment? And I guess really what I'm saying is, are there any bottom lines you and your organization have already put in place as to what work gets done and how it should get done in this new world? And Alan, let me start with you.
Sure, thanks. Let me see whether I can wrap this up in as shortest time possible so that we can have time for conversation. I think being an NGO based in the global south, I think for us, we've been a part of a wide range of collaborations. I'll start with regionally, where we work with groups such as Initiative for Strategic Litigation in Africa, Afya na Haki, and others on matters research and also strategic litigation. And so we look at that as an international partnership, though it's regional, it's partners across the borders. Globally, we have engaged, including with academic institutions such as the University of Southern California, the University of Warwick, the University of Georgetown, particularly the law school, and also with bodies such as the Global Fund, who are also collaborators in the work that we do on HIV and human rights, and also access to treatment and respecting people's rights. So we've had a range of collaborations focusing on research, focusing on advocacy, focusing on litigation, focusing on specific agendas, including also like drumming up Congress to increase funding for health issues through working with international NGOs such as the Friends of the Global Fund, which is based in DC, and we worked closely with. So also, though not considered international, we work closely with community-based groups, women rights groups, young youth organizations, people living with HIV, LGBTI groups, and for us, those partnerships often matter more than the international ones because you are largely dealing with the most affected people. You're dealing with the people who are facing the brunt of everything. And so for us at Kellyn, we find that's where the connection is with our partnerships, because we are all about centering things about people's lives, people's experiences, and giving them the platform. So in terms of success for us, even though donors may not like this, we don't measure success about the way we submitted a grant, the way we did in terms of financial performance. I think the first thing for us to measure success is to see, has the intervention we've been funded to do actually changed someone's life? So for instance, if someone was being violated at the workplace because of their HIV status, has my intervention as a lawyer to represent him in court and get that stopped, making a tangible change in their lives? Or someone who's not getting access to healthcare, or the research findings that we have they translated into something that has made a change in the life of the community? And then secondly, has our advocacy left to a shift in law and policy? So the amount of research we've done together with the University of Southern California, how then do we translate that into change of laws in Kenya, change of laws of politics, or even change of practice within a hospital setting? Third for me, and I will be coming to the current climate just to say the biggest success for us is power and credit shared equally among the people we are working with, especially for our community groups. How well are they acknowledged? How well are they respected? How well are they part of the success? And that there is no dominant partner. I think coming to the last part of the question, I think for us, the current climate has really made us more cautious. The fact that their political strings tied to funding is increasing, and that's inevitable. We have experienced grants withdrawal midway because of the shift that have happened in the US. or donor politics, which has left people with TB without interventions to be able to do, and some adolescents who live with HIV in limbo. So for us currently, our bottom line now is that if a partnership undermines the community, puts them at risk, or is silencing our advocacy voice, it's not worth it. Back to you, Sophia.
No, I super thank you for that. A great start for us. Natalia, can I turn to you, please?
Of course, and thanks, Sophia, so much for having the UN Development Program here today. And because I think some people may not think health when they think UNDP, let me take just 2 minutes to say why. Why does UNDP, an agency that is not the World Health Organization, care about health? And really, we think about the social, the economic, the legal sort of determinants and the environmental determinants of health. So what's happening outside? And for UNDP, the main partners are actually the governments, right? We work hand in hand with government partners, both at the national level, but also at the subnational level. We have a lot of work with cities to engage on issues to advance health and, importantly, health equity, because UNDP is the organization that is known at the UN for addressing poverty, for addressing inequalities, for really being the governance agency. But also our biggest footprint is actually on climate, on health, and I can speak a little bit about that. So our main, on the books partners are the government partners. But we have found that nothing can be done, especially in the areas of global health, without a very strong engagement with civil society. So we value and really invest in deepening relationships with civil society partners on the ground, whether it is advocates from key population groups, because we do a lot of work on HIV, or in the climate space. We're also finding that young people, a real investment in our engagement with youth who may not be organized in the same way as some civil society structures are. So partnerships are really important, and we are present at the local level in over 150, 160 countries. So we have a local presence, but we have regional teams and global teams. And depending on where you're situated, so I'm situated in New York, my work is much more around the policy and how are we ensuring that partnerships with academic, institutions are enabling us to give the best advice, data and evidence-driven sort of advice to governments. But at the local level, a lot of the work is really about implementation, and the Global Fund is a main partner, and we work in very difficult settings in countries where the government, for many circumstances, is not able to distribute and be there sort of to ensure that people are getting access to their medicines and everything. UNDP is there. And we work not as a humanitarian agency, but at that nexus. So a lot of our work is that intersection where the government may require our support in some way. So partnerships is everything to UNDP. And I do want to go to your second point about, what are the challenges? There are many, and I actually bucket them into 3 groups. One that is the sort of top of mind for everyone is the funding crisis that Alan talked to about, money really being cut in the middle of really successful projects. Are we getting enough money to buy the drugs we need? Are we able to support the civil society groups we've been supporting? That is top of mind, and I think will come up a lot in our conversation today. The second one is a shift in ideologies. We're seeing, as at the UN, a lot of what guides the work is the resolutions, kind of governments coming together and agreeing on language. And there is a real shift in what language is considered appropriate, not appropriate. And some people may think that this is not important, but actually narratives matter. And Sabine, I think, as an anthropologist, can speak a little bit more to that. It matters if we shy away from certain words like climate change or gender equality. And so for UNDP, it's that struggle of, we are at the service of an intergovernmental process, but we still have values that we need to put right in center. But my biggest thing, I think, is being overlooked is the long-term impact. The long-term impact of cutting, for example, data access. If we're not going to have any information on data because we're no longer collecting, certain information, how are we going to advise governments? And this is really important for the researchers in the room. Like if DHS, which is what I used to do my PhD, no longer exists, and I did work on GBV, how are we going to do that in the future? And the collapse of networks. There have been years of investments of civil society networks with support from international donors that suddenly have gone from a steady flow to zero, and those networks cannot be rebuilt overnight. So I really worry about these long-term, 5-year, 10-year from now, while we're worrying about the immediate funding cuts. It's those long-term trajectories And I think that's where I hope this conversation, or those are the insights that I want to bring about how do we prevent some of those long-term harms while also battling with the immediate short-term ones. Thanks, Sophia.
Love it. Thanks. Thanks. Sabina, please.
Hi, thank you. Um, I was just thinking about, Natalie and Alan made some really good points, and I resonate with them. We do, sitting in Bangladesh and as a professor. And I was thinking, some in crisis, you realize what makes successful partnerships or what unmakes partnerships. And I found during COVID, certain partnerships, because it was based on respect, we were looking out for each other despite funding crisis, despite, closures and lockdowns. We managed to get through to continue to do some research, try and push back government on certain policies. Um, and I feel for partnerships and these relationships of, for me, what defines success is the human dimension. What are the values we share? And ultimately, the values that we've shared and the work I've done with some of my partners in many different countries, because I work at the Brack School of Public Health, founded by the late Fazli Hassan Abid, which was all about disadvantaged populations and how do we improve their lives. And one of the advantages I've had is I've worked with some very good partners who have very similar value systems. So you ride or die, you work together. And even in this crisis moment, it is scary. There's lots of repercussions, lots of challenges. We're still trying to figure out how do we get funding? How do we continue some of that work? How do we draw on maybe the university, our school has some core support, at least encouragement to continue to do some of the work. At the same time, we do need to really look at resources. But partners then align. I've got some partners in different countries who are looking at taking some cuts in their overheads or in their own budgets so we can redistribute allocation so some of that work can continue because some work has come to a halt. In terms of talking about, Natalie already mentioned the long-term consequences, but even in the immediate, certain groups have become invisible. So in my country context, there's no funding, but also there's censorship. There's these ideological sort of wars going on about what you can or cannot talk about. And I'll talk about this later in terms of my teaching and in our research at the school, what we're still trying to do. But the reality is, I think the values of reaffirming global health and what that means to all of us and keeping humanity in the forefront is really critical from a rights perspective, from sort of just from doing no harm, doing good, inclusion, diversity, equity, all the things that have become uh, sort of seen negatively now. It's almost like it's a swear word to mention equity or diversity or inclusion. It's almost like you have to hide and have these conversations. But anyways, I think this is what some of my thoughts are about the value and principles that guide successful partnerships. It has to be in alignment. Yeah.
Super helpful. Super helpful. Keith, I turn to you.
Thank you very much, Sophia. First of all, I just would like to thank you, Sophia, and your team of Megan, and Caitlin and Linda for putting this together. As you shared with all of us before this call, it is ever more timely that we have these conversations publicly, because some actors may want to come in and trample over things we've been working on and principles we've adhered to, doesn't make it right. So what I would like to focus on in this is not to reiterate what Alan and Natalia and Sabina have said, which I fully agree with, but just to share with you some of the things that have worked with us at CUGH and what we're doing in the future, what we're doing now and what we're doing in the future to deal with this very concerning situation. So I think at the bottom line, what keeps me, and I'm sure all of us, awake at night is the impact that what's happening now in people's lives, who can't, who cannot and don't have the power to speak out, and they're losing their lives, notwithstanding some of the nonsensical comments that this is not happening. It is happening. People are dying, and we know that. So all of us here and our colleagues around the world are pivoting to address that, and as Alan said, improve people's lives. So at CUGH, what we've always done and what worked for us, as most of you know, because we worked with you, is really focus on collaborative, effective, impactful collaborations that deal with the problems that our colleagues in the host institutions are facing. As a colleague of ours, Dr. Claire Payne at the University of Toronto, who's a wonderful psychiatrist who worked with the Ethiopians to develop a capacity building program, when she asked a colleague of hers, um, how do we partner? The colleague said, my country, my problem, my solution. So we come to that with our ears open and listen. And so what we've always focused on is trying to use our power at CUGH to convene people around really important problems and issues. So, for example, with the African Forum for Research and Education Health, AfriHealth, they've now built up to have a 70 institutional consortium with an office in West Africa. Their meeting, in fact, is on the 20th to the 22nd of this month. And we worked with them to support them to strengthen their own capacity. So we certainly see ourselves at CUGH as what can we do to support you, wherever you happen to be, to build out your capacity to deliver outcomes that make an impact on people's lives, particularly on the issue of capacity building on education and research, and also the translation of that research to improve people's lives. Closer to home in the United States, we work with the National Cancer Institute to build out and create their signature International Global Health Day, which is now going into its 13th year. And that empowers them to bring in cancer experts around the world. So we use that power at CUGH to do that. So just briefly moving forward, I think at CUGH we are convening and we'll put out a document in the next year and a half of how to do global health better, how it can be more impactful. We're also increasing our advocacy, which will be 1/3 of our work. And we will be in the capacity side briefly. Um, we want to forge and build relationships between academic institutions and governments to strengthen government's ability to be able to deliver public programs, which we know without political commitment and public service capability, you're really missing the foundation of development. And so we see that as an opportunity, amongst others. But I'll stop there, Sophia, and thanks again for including us in this opportunity.
No, I mean, thank you. I mean, can I stick with you just then for a minute? Because I think one of the things about what you're saying is, I mean, clearly everybody is affected, but it also sounds like there are some positive things that are happening in terms of partnerships. And I wondered if you could say something more about any positive ways you're seeing of partnering happening in this operating environment that we can learn from. If there's anything in terms of what consortium members are dealing with that's happening that you think is different now that's important to put into this conversation in a very kind of concrete way. And yeah, just if you have just a couple of reflections on that, it would be great.
Yeah. No, thanks, Sophia. As was mentioned before, I think that the people are looking to how to do things better. What was really encouraging from our last Global Health Conference, our next one will be in Washington, April 9th to the 12th. So cuh2026.org. You're all invited to come. Please come. A lot of our members in LMICs are saying we need to put pressure on our government to step up. And they want to be able to strengthen their government's capability to do this. So I think there's a new approach, Sophia, to not people not to be waiting but to be more assertive with their governments. And they want their governments to step up to the plate. And they see that there are resources there. They want to deal with the issue of corruption, which we don't talk about very, very much. But if you deal with the corruption issue, then you're going to liberate between 1.5 to $3 trillion of resources a year. So that really empowers institutions. And so we're going to be working with LMIC colleagues to be able to work with them to engage with their governments, to build their own domestic capacity, and also to connect local academic institutions with their governments to do the research that governments don't have the capacity to do. So I've spoken to ministers of health and said, Keith, I wish I knew that answer, but I don't have the research capabilities of doing that. So I said, look, here's your institutions. If you want, let's figure out a way. So there's a lot of positive desire to do that. So let's see if we can bring that together for really positive outcomes.
Okay. And let me move, Sabina, let me move to you because we're talking about universities, if that's okay.
Sure.
Universities very much here in Los Angeles have been severely impacted by all that's happening, right? And all the issues that are there. I'm curious about in terms of your own research, how these issues have impacted, not in generic, but like very specifically to you in your university context. But really, the reason I'm asking that, I mean, of course, I want to know, but the reason I'm really asking that is, how is this changing how you think about what it means to lead research teams, what it means about how you think about communicating with existing partners. And mostly, I mean, maybe I'm asking really personally because this is like an issue for me, is what does this mean about how you're teaching your students? Like how is this shifting things?
So there has been shifts. I just wanted to add one point to Keith's because when you're talking about partnerships, I think a lot of that approach about co-designing, co-developing, and capacity sharing is key as we move forward in this sort of changed climate, which works better in terms of partnerships. I just want to add that point to Keith's very interesting work at CUGH. But in terms of teaching and research, so research, as I said, if you have these partnerships, and I've been lucky, we've had a few solid partnerships in our gender and SRHR work and our health and poverty. But of course, as globally and in Bangladesh, some of the, diverse sexual diversity work, some of the gender rights work has been affected. One, through funding, there's been cuts, but secondly, there is an appetite for sharing. So what does one do? Do we stop the work? Of course we can't. We have to continue the work. So there's support for the work, and in some ways, as I said, we either reallocate resources, we figure out more cost-effective ways because we have a lot of national level partners. There's a lot of allies, both globally, both locally. It's clever ways of continuing the work. So some of the work we're doing closed door sharing of evidence because we still need evidence to kind of impact on programs and policy, even if there's less funding. Other ways we're working around it is for some of our work on sexual diverse communities, we're doing global podcasts rather than local podcasts so that there isn't attacks on scholars and professors and teachers within the university, also within the country, because there have been some, unpleasant sort of threats being given to individuals. In teaching, I think Brack School of Public Health, one of the advantages we've had is we've always had community-based teaching. In fact, we've been featured by WHO, by Johns Hopkins, and we've always had teachers from different places, McGill, Stanford, India, Liberia, and from within Bangladesh. With teaching, I think this is a time when we continue to reaffirm the principles and values of global health because our students come from all over the world. We've had about 700 students from 35 different countries where you continue to talk about equity, diversity, inclusion, why it is so important, human rights. But I think one key thing we do in our School of Public Health is we talk about structural and social determinants of health. As we move beyond the biomedical model, I think what we need to start talking about in our teaching is partnerships and how do we anchor within countries and across countries. So to remember that, hey, remember the whole decolonizing, Sophia, we've all been there. But I think part of the challenge of decolonizing, it became us versus them. But the reality is, if you look at abortion or human rights or gender or many other issues, it's been transnational movements. It's been movements across countries and people. And it's bringing students back to that, saying, hey, you live and work in Bangladesh, so why do contexts matter? What can you learn and build in your technical know-how? What can you share? But two, I think it's also an opportunity to learn from each other, from our other partners, from other faculty. And this is where I think Natalie and Alan and Keith were mentioning, bringing in practitioners, which we always have, bringing in other educators as faculty at the School of Public Health. We continue to do that. But I think it's continuing that, persisting with that. My final point is, I think this is an opportune moment for students from institutions in the North to come and learn because 80% of the problems are in the developing countries. So how do we create solidarity in the new generation of young public health leaders? So they have sort of empathy and learning and these sort of universal global health values. I think that's the way we continue to teach. Yeah.
That's helpful. That's helpful. I mean, I guess what I want to add into that is also thinking about how do we talk about politics and where politics
Yes.
Right. So like how do we think about that? And Alan, that brings me to you if I can, because I really want to get into the addressing the political side of this in terms of what it means in terms of global health partnerships. And when I think about you, I think about how you've been really on the front lines of so many of the legal fights right now in response to the denial of funds. And I have to say, not only to local organizations, but also to the UN. And I just wanted to ask you, is there anything different about how you're thinking about advocacy now than you did previously? How are you deciding what fights to take on, which ones not to? How are partnerships part of this
Mhm.
in terms of how you're thinking about all this, again, in the current moment? Okay.
Okay, thanks, Sophia. I think that's quite a loaded question, but let me try to see how to break it
Sorry.
down. Look, so let me start with what has worked for us from advocacy, both in the past and even what's still working now. As a human rights organization, as an organization that believes in the rule of law, I think for us, using the courts has remained an important shield, especially in situations where donors or foreign countries are pushing an agenda or issues that are not in line with what our Kenyan constitution says or what our law says. So we then turn to what we know best. How do we litigate? But even in the litigation, how do we bring the affected communities on board in terms of being ensuring that they're there? We are currently pursuing litigation around saying what then is the obligation of the state when donors walk away and people have been on lifelong treatment. Does the state have to step up, especially if it's children and they're taking ARVs and they need it as part of their lives? So for us, it's unpopular sometimes, but politically you get backlash, you get sidelined from partners. But I think litigation gives us that blatant way to be able to address this. I think the other way that's working and seems to be continuing to work slightly is joint advocacy statements with regional and global partners around either issues affecting the African Union, the African Commission, or in cases where there's push to reduce the sizes of UN agencies or push them to take certain directions that would be contrary to the values that they have. I think for me, I see a lot of power when there's a coordinated voice from Nairobi, from Bogota, from Kampala, or Geneva, or DC coming together. So I think for me, those are the two things that are working, have worked for us in the past that we are still employing in this particular day and time with the circumstances we have. I think what hasn't worked and needs to be mentioned, especially on these particular issues, is token advocacy. We've seen experiences where their partners in different countries write statements without community buy-in, and then they either want you to endorse or they take it forward, and then it ends up exposing you either politically, legally, or in one way or another. So I think that's something we should not do, and people should not do, and we should not continue to do, because you have to understand the circumstances of what your statement and action may mean for different people. And I think what hasn't worked, and particularly now because there's so many battles, trying to fight every battle. You can't deal with everything. You can't fix PEPFAR living, UNAIDS, I mean USID living, or anti-rights movement coming for you. You have to then very carefully choose your battles, because staff get burnt out, communities get tired of being on the forefront, and many other issues. So one lesson I've learned is not to fight any battle. So in terms of what then do we do in making and choosing our fights, I think the first thing for us is that, is there direct and immediate harm to the community? Has someone been arrested? Has someone been abducted? Has someone faced discrimination? Has someone's license been stopped and procedurally? That we have to interact. We cannot stop even if we don't have funding. It's a need that needs to be addressed. And then for us, will whatever we're intervening in have some structural precedent. For example, if you're litigating about reproductive health and the anti-rights movement is pushing about the age of consent from 18 to 21, how do we litigate in a way that this doesn't have to arise again? And then do we have the right partners and evidence to sustain it? Or do we need to redirect to other people? Or do we need to wait? The timing. So it's what is immediate, the outcome of intervening, what broader picture does it have? I know the colleague from UNDP talked about the long-term impact. So we're also looking at whatever we intervene now, what does it mean for the future? And then do we have the right partners? Do we have the right evidence? And I'm not just running on it. So I think for me, in concluding on this question, Sophia, I think for me, Cross-border coalitions give us courage. We've done a lot on global fund advocacy where African voices get amplified in the Congress, in different places, and we're aligning between advocates from Latin America, advocates from Asia, going to the Hill, speaking to politicians, speak about the importance of continuing certain streams of funding. And then I think for me, the role of partnerships again becomes important in terms of seeing how do you stay connected with communities so that you have a reality check with the people you're actually advocating alongside with and know that you're actually doing the right thing that is benefiting from them. So my long-winded answer is that way, but it's definitely a learning lesson in the environment you are in now. It's a very grave and difficult environment, but again, you don't waste human rights in a crisis. You must find a way to make human rights work in a crisis. There's no other way out. Back to you, Sophia.
I hear you. I hear you. Thank you for that. And Natalia, I'm going to turn to you. I mean, we keep coming back to this question about the long term, and and you signaled up front that this is really something that you're concerned about. And I was really concerned about thinking about how national political priorities impact what issues are prioritized and funded globally, and what that means for how different kinds of partnerships can operate. And basically, how do we think about it from a kind of a UN perspective? How do you deal with constantly shifting donor priorities impacting what can be accomplished? And when you keep that long-term vision that you were talking about, like what does that mean in terms of what strategies need to be in place? And it's one thing, and I want to just complicate the question a little bit if I can, because it's about pursuing issues where the evidence is clear. But one of the things that's really hard these days is where there's new thinking and innovation needed, but in ways where people are looking very short term. How is it that you can think more broadly? How is it that you can help us to think more broadly in terms of how to think about addressing global health issues in ways that can really transcend election cycles? And hopefully I won't bip out again.
Thanks so much for the question, Sophia. And I mean, I think it's a complicated one in the sense that, the UN, I think, tries to avoid that election cycle shifting by creating these long-term agendas. We have the Sustainable Development Goals right now. It was a 15-year agenda before it was the Millennium Development Goals. The Paris Agreement has a way that every 5 years governments reconfirm and kind of amp their ambition through the NDC process. So I think on paper, the UN is thinking about the long term. And some may say that actually lowers the ambition a little bit because you have to have every government agree, and the UN works by consensus. And we're seeing that today. We're seeing that even the SDG agenda is considered sort of problematic by a few governments. And there's this pull towards really focusing on, national sort of sovereignty and not, but I think it's important to highlight that just as health is political, foreign aid has become very political. Governments, their populace, their people really are not interested in foreign aid. And we're seeing that across the board, whether it's in more conservative leaning kind of elections where conservative governments have won, but also in the UK where you would imagine, so we're seeing donors, the traditional donors retreat from places from Sweden to the UK to the Netherlands to the US. The US is the most felt right now because they had such a big footprint through USAID and through others. Their budget and to WHO is really, really, leaving WHO is being felt. But I should say that this is a more universal kind of thing we're seeing. So, and I kind of want to go back to Sabina's point about, how do we think about this decolonizing global health conversation? Because I think it is forcing the UN to think about who are the new partners. Where do we, and new partners in a different way. It used to be a little bit more like who are the donors and who are the not donors and this kind of dichotomy. But now we're seeing, India and China and other countries, even smaller, Indonesia giving to Gavi, we're seeing some real shifts in those categories. And I think that's important to break down those categories of donor and recipient and partner. And if we can do that well, that could be successful. But I do think it carries risks. I think, we can't assume that the new partners are going to be more benevolent or there aren't going to be widening inequities. So I do think there has to be some thinking around those partnerships. And, so for UNDP, I think one decision is to broaden, and it also, because of the financial crisis, we're also thinking about where the locus of kind of the UN will be. So we're talking about it headquarters number 2, and right now exploring around the world whether, moving people. Nairobi has become a big HQ for the UN, shifting kind of the footprint of the UN to other parts of the world. That's, a physical manifestation of some of that shift. But, going back to your point about innovations, the things that are coming up a lot in conversations are AI and digital, the role of the private sector. Those are the kind of and I think there's this hope that all of those things, the private sector, digital, and technology, will sort of save us. Will save us in this moment. And it's worrisome. And for those of us in public health, I think we're trained to be quite skeptical. On the other hand, we can't stay. I've kind of decided that we can't stay completely skeptical. Like, if we can't get workplaces to put in place, measures to protect their workers, that is the private sector. We do need to engage with the private sector. And I think because we're thinking multinationals, we aren't really thinking private sector at the local level, which is smaller groups. So I think, the public health community needs to be at the table to talk about, what is private sector engagement and how do we do that well. We need to be in that conversation around digital and AI and how can that be used in low resource settings in a way that actually health inequities can narrow, rather than focusing only on sort of the risks of AI and digital being kind of a racist tool that replicates, so I'm going on and on and on, but I'm saying that the innovations and the solutions that are being brought up, we need the public health researchers at the table. And I think we do need people from the global south there much more than those in, academic institutions who are not seeing the lived experience, who can't say, yes, you could compare this AI tool for health services to the doctor in Boston or New York, but in fact, if there is no doctor, is this AI tool better? And and what are the risks in this setting? So I feel like there are many, many conversations that partnerships between academia, government will bring together. And I should say that I am seeing foundations step in a way that has been useful. Welcome, for example, is really investing in building capacity in universities in Africa and other places on the climate and health space, which is one that I'm in. And to Alan's point about litigation, I still think litigation is really, really important, both in the US context and globally, and on the climate and health front, that has been very successful. So sorry I rambled a little bit, Sophia, over back to you.
Sorry. Sorry, I clicked out there. So no, that was super helpful. I want to actually stick with you for a moment, and then I want to ask kind of everybody the same question and just kind of briefly. We're talking about partnerships. We're talking about partnerships in all sorts of different ways. What does it look like to be a good partner in this moment? For you to be a good partner, but what is it that you look for in others in terms of some of the common principles that you want to hold on to? Each of you has raised a couple of things in your interventions, but I kind of want to pull it out explicitly. And yeah, Natalia, may I start with you and just kind of do like a round with everybody on that?
I think I want to go back to Alan's point about in this moment, some groups have more to lose than others, right? So I think UNDP should be standing up. We have less to lose than a small civil society group putting out a statement. So I think realizing what you have to lose and what you can gain and what, and stepping in and having the behind the scenes conversations and saying, okay, we will put out the statement in our name to protect you if there's agreement. So it doesn't feel, that's one thing that people should look to each other to have honest conversations behind the scene. I think transaction costs right now in this moment, everybody, because there are so many issues happening, as again, Alan said, you kind of have to pick your battles, and the transaction cost of everybody being involved everywhere is pretty high, is thinking about how we organize ourselves in partnerships that are trustworthy and trusting to say, you lead on this, we'll lead on this, please do show up for this event, kind of being politically savvy so that we don't all burn out trying to fight 100 battles, but really realizing where we each bring greater strengths. Those are two important points. And I think the points that have been raised earlier about when to keep it local, when to make it regional, when to make it global is a really important strategic one. And I think it's not only in that direction, when the US left sort of the climate, Paris Agreement, we saw a lot of local action saying we're still in it. And so I think depending on the topic, there will be places where actually making it quite local is the right strategy, and in other places where making it global is the right strategy. So, I think for UNDP, we haven't always been the best partner. I can say that, we sometimes are very close with our government partners, right? We are, but that is a role that we play. So what I say to civil society groups sometimes is like, I can do this. This is my role in this context. You do that. You put pressure from the outside. You bring in the research. I may stay kind of neutral in this conversation, but I'll bring you into the conversation with the government. So really trusting that, going back to Sabina's point, that our values are aligned, that the ultimate goal, but we may have different limitations, and being open about those, I think will be important in this moment.
Alan, response to that.
Real quick, being a good partner, and what do I look for as we work with Kelly? I think one, we want a partner who shares risks with us. We don't want a situation where we sign up to do something and then something happens and then we are left by ourselves licking our wounds while people go on with their lives. So if you can't share risks with us and face the brunt we are facing when either governments or anti-rights movements come for us, then there's no need for us to be in this together. So I think that something is important, and I think it's both to the global North and global South partners. Are you ready to stand up with people when the backlash comes? And both for the NGOs, when the political heat is much, will you still be there? I think that's a criteria for us, and that's what we ask. Secondly, is transparency. I think for us, if there are restrictions you have, if there are limitations you have, and you want to partner with us, just tell us upfront so that we don't discover halfway or through the funding, and then we're doing something and you say, oh, but we can't support staff time. We can't allow to pay for that because it's not eligible and it's not allowed by our rules. So be transparent if you want to partner, both on our side and our side, and we agree on the line. I think the third thing for me, and the final one on this point, is that you literally have to center local expertise. We are currently in a consortium called the Digital Health Rights Project of researchers, human rights folks, young people living with HIV. And I like the research that we're doing around SRHR. But what I like more is that everyone is seen as a local expert. The young person is not less junior to a senior researcher, or a person living with HIV, or the lawyer is not more superior. And so a relationship where we co-design either a research strategy, a litigation strategy, an advocacy strategy, I think that makes the outcome much more stronger and better, rather than people seeing you as sub-grantees or downstream partner and aspects like that. So for us, we're coming on the table with all expertise. So recognize my expertise, whether it's from a community group, as something that adds value. So for me, Sophia, those would be the three things that matter. Share risk with us, be transparent, and center local expertise.
Super helpful, super helpful. Keith.
Okay, so just want to get back, if I could, to Alan and Natalia's point about advocacy. As a former politician, I can just say that we still do advocacy very poorly, but I think we need to do it a little differently, particularly as the risks were outlined by Alan. And what we're doing at CUGH is really bringing in, for example, in the US, we're bringing in and reaching out to the Republican Party to listen to what their goals are. And we're framing what we do in that context. So if you want to make America healthy again, if you want to make it stronger, more secure, and richer, well, here's what we're doing to achieve that. So we're reaching out to bring them to the table, for us to listen to them, to try to build up some trusted relationships, and to be able to share with them what we're doing and how what we're doing fits in with what their objectives are. And it's a relationship. We have to communicate properly. The other thing we're doing is to communicating to the public. So putting out a press release or a commentary does nothing. You've got to build a relationship with the public. You've got to inform the public. So what we're doing is we're training global health practitioners to be public scientists, to be able to communicate effectively with the public as well as with policymakers. And we have some partners to do that with. So we really feel that's exceptionally important. And to be a good partner, agree with what was being said before, but also, if I could add, it's got to have impact for people, capacity building, locally directed, We're the secondary partner that come in when called, and our hand is there. We are there shoulder to shoulder, but we are there to do what we're asked to do, not what we assert that's necessary. But it has to have long-term outcomes. It ought to be capacity, long-term capacity building and sustainable. And finally, just to emphasize this point, it's foundationally in terms of development, regardless of where you are. We all know political commitment and political and public service capacity long term is vital to delivering public goods. And we miss that opportunity. So I think for us at CUGH, there's a great opportunity to do that with our colleagues overseas, but also to deal with domestic challenges in the countries we're working with, including in the US, which ranks what 37th in the world in health outcomes. Well, that's an opportunity for global health to work. So back to you, Sophia.
Thank you. Sabina, on this question.
What everyone said, and I would just add respect, honesty, being fair, recognizing everyone's a knowledge bearer, so we bring something to the table. So interrogating these hierarchies of knowledge and recognizing there's actual capacity sharing at different levels rather than this one-way approach. I think, you can see the respect and honesty and transparency when knowledge and data ownership and sharing and writing and authorship, and also in terms of allowing for shared leadership, allowing for joint discussions on what kind of policies, what kind of priorities. So all of that really should be the guiding principles. And a final point, because I know we're close to the ending, is we also have to recognize partnerships can be bumpy. There can be mistakes made, but it's about staying the course if you have those values that you really want to make a difference and work together in global health and work with communities that are most directly affected. Yeah.
Super helpful again, everybody. I'm going to do I'm going to call it a lightning round, like we're on a game show, which is that I want to go around and just have each of you answer like in a minute or less my last questions, which is really about suggestions or ideas where we should focus our efforts. Let's end on something positive if we can. Give us your vision, one action idea to support global health research partnerships going forward. I hope that's a fair question. Sabina, can I start with you since I just ended with you? Is that okay?
I think more coalitions and solidarity so we can counter the narratives that are going on at the moment, work together, be it media, be it advocacy, teaching, research, but really coming together for a shared vision, for a different world, a better world.
Very positive. Thank you. All right. I'm feeling positive. Okay. Keith.
One example, we're working with the WHO on strengthening their emergency critical and operative care. And what we would encourage folks to do is reach out to their governments, build a relationship with them, understand what their capacity needs are, and then offer to work with them to meet those capacity capabilities. And finally, come to CUGH 2026, CUGH2026.org next April in Washington, D.C. We're coming together to build forward better. That's our futures. Well, our theme. So,
Right.
and
You couldn't
much thanks.
resist. It's all good. It's all good. Okay. Natalia, please.
I think for the students and young people is get involved, whether it's in your local politics or back home. If you're an international student, get involved right now in any way, whether it's on climate, on issues that you care about. And for those who are more in positions of power, is like invest in those networks that you've invested in the past. Try and find a way so that we don't lose those connections, especially if it's key populations or groups that really don't want they've given so much to trust, and then we're at this moment. So I think just invest in networks and maintaining those and that human connection, as Sabina had said early on. Thanks.
Thank you. Alan.
Thanks. I think in a minute, three things, which is what should we focus on? One idea and my vision. I think what we should focus on, at least coming from a civil society perspective, an NGO perspective, we should focus on protecting civic space. It's shrunk unbearably in a manner that cannot be comprehended. And without the ability for communities to organize, to speak, and even protest, all the funding and research partnerships in this world won't matter. So What should we focus on? Definitely civic space. And one concrete idea is trying to scale up south to south legal advocacy networks, because I've seen how in East Africa quickly strategies can spread, especially what we've been facing with people being abducted, people disappearing because they're criticizing governments, and the use of precedents so that there can be a balance between global health power dynamics and better donor initiatives. I think my last point, which is the vision, as I said, the crisis for me and for others, we should look at it as a reset moment. If we use it to build partnerships where countries in the global south or lower middle income actors aren't invited later, but are the ones shaping the agenda from the beginning, then something positive will have to come out of this very difficult period. And as I said, whenever we're in a crisis, let's not forget we have human rights, and we must use that opportunity in that crisis to push for a human rights agenda. Back to you, Sophia.
Thank you. I mean, thank you to all of you. I think, and I just really want to highlight the different perspectives that you bring and how complementary they are, and how much, at least for me, that how much I learned like listening to these different pieces. And I do feel it's a really important start for how it is that we're going to go forward and thinking about kind of the other events and the other things that we want to do. So personally, thank you to all of you. But also, I'm sure as the audience, everybody thanks you. And I want to thank you, audience, also for being here. Thank you for coming to today's event. I hope you all found this to be as thoughtful and thought-provoking as I did. Let me just share quickly that we're going to do a next event on September 18th, if I can, where we're going to be discussing how physicians are leveraging their clinical expertise, their patient relationships, and professional networks in this moment. So continuing with this partnership. And please, everybody, stay in touch and let's stay connected, and really grateful for all of you. All right, all the very best. Take care, everybody.